Good afternoon, everyone. It's a pleasure for me to be speaking today at this event. And thank you so much for the organizers and for the hosts for inviting me. My name is Aikerim. I'm a healthcare data analyst. Originally, I'm from Kazakhstan, and I started working there in the healthcare industry. I've been working as a clinical data analyst. I've been working with EHR systems and digitalizing the clinical data. And then I came to US to pursue my master's degree in data analytics. And after that, I got my job as a data analyst at MSP Recovery. So today's topic will be the ways data analytics can improve healthcare billing. Did you know that healthcare billing errors cost the industry up to $100 billion annually? And these mistakes not only impact the bottom line, but also it frustrates patients. And in today's fast-paced healthcare environment, the billing efficiency is crucial. And data analytics offers a transformative solution that's going to reduce these costs and improve revenue cycles and increase the patient satisfaction. So let's talk about a little bit of statistics here. So in 2022, US healthcare spending reached staggering $4.5 trillion, which costs exceeding now 18% of GDP. And it is $13,500 per person in average. An aging population and rising service costs are pushing our system to its financial limits. According to Census 2023 data, the US population, aged 65 and over, reached 17.6% of population, which grew 5 times faster than the total population over the last century, which is, of course, placing a significant strain on Medicare and Social Security. As more people are using this program, the need for efficiency and cost control in healthcare has never been more urgent. And so what is the role of data analytics in healthcare? So first of all, data analytics is essential in optimizing healthcare billing processes by identifying inefficiencies, preventing claim denials, and improve coding accuracy. So it enables us to move, to shift from reactive to proactive billing, reducing costs and improve financial performance. Let me talk about the company that I work at, the MSP Recovery. So MSP Recovery is the Medicare, Medicaid, commercial, and secondary payer reimbursement, recovery, and technology leader. And to sum up what we do at MSP is that we work extensively with the large healthcare data sets, mostly from Medicaid and Medicare. And we try to identify and recover the claims that were improperly paid by leveraging advanced analytics to address those inefficiencies in the billing process. So in my particular role, I focus on analyzing large data sets to uncover overpayments, upcoding, or even fraudulent billing practices. So by using machine learning models, we are able to flag those claims with the likelihood of having an error or fraud. And this allows us to recover millions of dollars of our clients, primarily health plans and government programs. And ultimately, this reduces wasteful spending and, of course, saves taxpayers' dollars. And using advanced data analytics and machine learning models, we are able to identify the claims that were incorrectly paid by Medicare. So to provide you an example, using those models and algorithms, we see if, for example, we're trying to identify if the claims were paid by Medicare but were supposed to be paid by car insurance company. And so by training the model with data, with all the historical data with the patient's demographics information, with payments, history. We train the data, we try to identify it. And also we include the diagnostic codes as well. And so, but what are the major challenges in healthcare billing? Not only for MSP, but in general for the industry. So the first of all is billing inefficiencies. Coding errors in incomplete documentation and delayed payments and claim denials and underpayments, and of course human error. All of this cause delays, disrupt cash flows, and increase administrative costs. Another challenge is fraud. So fraudulent practices such as upcoding cost billions of dollars annually. And by using advanced analytics, we can detect patterns that point to fraud, helping to safeguard the organizations. And high denial rates and slow claim processing impact revenue. So revenue cycle management is very critical for maintaining financial health. And so how data analytics can address these challenges? Of course, by using advanced data analytical techniques and machine learning, we're able to optimize billing processes by identifying the patterns and reduce delays. Predictive models and machine learning algorithms can also identify fraudulent billing practices, like services that are not rendered or upcoding. And also predictive analytics help to improve the payment accuracy and reduce claim denials, which is going to increase the accuracy and efficiency. And so when it comes to advanced techniques such as predictive analytics and machine learning, so machine learning so these two tools are of course essential in addressing those large healthcare issues. So predictive models can forecast future healthcare needs, helping us to prepare for all these issues such as aging population and rising costs. And AI-driven systems, machine learning, can also help us automate the claim processing, ensure faster and more accurate billing. All of these technologies are going to make the healthcare system not only more efficient, but also more sustainable, since we are going to free up resources that can be redirected to patient care. So data analytics also ensures that the healthcare providers comply with complex billing regulations, and by automating the monitoring of billing codes, payment timelines, and documentation accuracy. So this is going to reduce the risks of fines, the audits, and ensures the ethical billing practices. And when it comes to patient satisfaction, it is crucial for the healthcare organizations to have a transparent billing process so that the patients are going to receive accurate billing, and it's in the long term, it's going to build a stronger patient relationship, and it's going to foster long-term loyalty. And to sum up my presentation today, I want to say that all of these challenges in healthcare, such as raising costs, inefficiencies, and frauds, needs to be addressed today, not tomorrow. And this is a huge strain on our system, and we need more data professionals to be involved in the healthcare industry because their expertise are going to help to solve all of these issues. And many non-profit and for-profit organizations are already working to solve these problems and to streamline the healthcare billing processes. And all of this is aimed to save taxpayers' money and make healthcare more accessible and affordable. And these initiatives are going to benefit everyone, the patients, the providers, and the society as a whole. And if we think about the future, we shouldn't forget about the burden on the social security funds. The aging population will double by the year 2060, and it's going to put even more pressure on these programs. So data analytics and AI are going to help us to forecast and manage all these costs, but we must act now to ensure that in the future we'll have sufficient funds. And by leveraging all these data-driven technologies, we can create a more efficient healthcare system today, securing a better future for all of us. Thank you.